Okay, so I'll just read out the case for everyone that's anyone that's not read it. So it's foundation year 2 doctor in the paediatric department. The patient is Melanie Carl. She's a 30-year-old lady who's brought in her 2-year-old child, Jenny Carl. She's got a daughter who's 2 years old. Jenny, her daughter, has had a fit at home which lasted 2 minutes. The temperature is 38.5 degrees Celsius. On examination, there is redness over the left eardrum. The rest of the nose and throat are normal. What you must do, please talk to the mother, take a focused history, discuss management of the child, and address her concerns. So before we do the station, just a quick reminder. I mean, we have covered this in previous sessions, but this don't forget to ask the extra questions for paediatric stations. So one way I use to remember it, this is just something I've made up. I don't know if anyone else came to this same conclusion, but I just thought it comes together as Biden, the American president. So I use that to try and help me. And then if there's time or if it's relevant, you could ask about bowel and bodily movements, and you can ask about looking for clues or screening for non-accidental injury. So that's just asking about who's at home with the child. Basically, you don't want to it's quite a sensitive topic, so you don't want to upset the patient by asking them, is anyone in the home hitting them or something like that, because that would just be inappropriate. So that's it. So very the same structure as before. Just remember to ask 1 or 2 questions for each of these. I just like to ask, so for birth history, I'll just split it into 3. So pregnancy, delivery, and then aftercare. So delivery with pregnancy, any problems happened during the pregnancy. Delivery, was it cesarean or was it normal vaginal delivery? Any problems during the delivery? And then aftercare, did you have any any specific aftercare afterwards, or was it all just kind of routine? And then immunization, so they're up to date with all their vaccinations. Are you happy with their development? And what's their diet like? Are they eating well? All that kind of thing. If they're young, if they're breastfeeding or they're bottle fed, all that kind of stuff. You might want to ask, actually, even if they're older, about breastfeeding and bottle fed, because it can be linked to like certain conditions, common conditions like asthma and celiac and all that kind of stuff. So it might be worth asking there. Just wee and poo. So in paediatrics, I mean, that's just a memory aid. Bit, it's a kind of layman's term for describing feces and urine. But I think if we so for paediatrics, if they're not potty trained, then you can ask about, the nappies, how regularly the she's having to change the nappies, and how regularly they're dirty, how regularly they're wet, that kind of thing. And if there's any change. And then for non-accidental injuries, like I said before, just kind of, just a quick question about find out what's going on at home. Is the father around, that kind of thing. I wouldn't ask it like that, but and ask it in a sensitive way. Try and find out who's at home, so you can get an idea about the support network that's available to the child. And then the rest the same as before. So really, these you should not waste too much time. These should just be really quick questions. Is that all right, Doctor?
Yes, that's fine.
Okay, so okay, when you're ready.
Okay, that's hello. My name is Doctor. I'm the one of the doctor here. Can you please
Hi.
tell me your name?
My name is Melanie Carl.
Okay, so I can see that you brought your daughter here. Can you please tell me her name?
Yeah. My daughter Jenny. She's her name's Jenny Carl.
And she is 2 years old, right?
That's correct. Yeah.
So can you please tell me what brings you here today?
Well, my child has just had a fit today, about 2 hours ago at home.
All right, sorry to hear about that. So can you please tell me a bit more about that? How did it happen? What was she doing?
Yeah, I mean, she was just I was in the kitchen. My 2 children were in the living room, her and her brother. And yeah, sorry, not my brother, her brother. He started calling me, telling me that she's having a fit.
All right. And what time was it?
So this was about 2 hours ago.
All right. And she had normal breakfast or the meal before the convulsions or fever, the fits?
No, was that normal breakfast?
Yeah. I mean, did she had any meal before the fit? I mean, she ate
No,
something before.
no, no. I mean, she had just normal breakfast in the morning and then lunch.
Okay. And during the fit, how long did it last? Did you
Um,
notice anything?
yeah. So it lasted maybe a couple of minutes. Actually, it was probably even less than that. I'd say less than a minute.
Okay.
Um,
And
I
did she
noticed.
lose?
Sorry, just the second part of your question. Yeah, I did notice that she was floppy and pale afterwards.
Okay. And she lose her consciousness during the. Did she fainted while fitting?
I think so. Yes. And from what my from what I saw and from what my son told me. Yeah.
Okay. And did you notice anything that she passed her urine or any bowel movement or something like that? Did you notice anything like that?
No, I didn't know.
Okay. And after the episode of the conversion, was she drowsy or did she fainted?
She didn't faint. She was a bit kind of lethargic afterwards. Yeah, for a while I would say. Yeah. But she's been unwell, I think, over the last few days.
And did she had any episode or spike of fever?
Yeah, she has, doctor. Yeah, she's had a fever for a few days now.
Okay. And a few questions like now was she had normal you had normal delivery or was
Uh,
it a C-section?
it was a normal delivery. Yeah.
And it was a term birth, right?
Sorry.
It was a term birth when
It was. Yeah.
on.
Yeah.
All right, and she's up to date her immunization.
Yes, she is. Yeah.
Okay, and anything else you would like to tell?
Not really, doctor. I mean, I did notice if it helps. I mean, I don't know if it's important, but she's been pulling at her ears quite a lot the last few days. And, it's just kind of like, yeah, it's a bit irritable. Like the right ear, she's been pulling it quite a lot over the few days. But apart from that and the fever, she's been okay.
Did you notice anything like that before, a few months back or something like that, or is this the first episode?
No, no, she's never had a fit before. No.
Okay. And did anyone else in her sibling or anyone else in the family had such episode?
Um, yeah, my son, when he was
Okay.
younger, when he was about 2 years old, he had a couple of fits actually. Also, they were also after having a fever as well, actually.
And did you measure the fever? No.
Yes, it was 38.3.
Okay, so after discussing the history, I think the episode she had was probably due to the fever, which we call as a febrile convulsion. And it is not usually common, but in children, when the fever goes above 38 degrees, so the children can have convulsions or fits with the fever. And there is nothing to be worried about, but we are going to
Oh, that's
run
good.
some yeah, we're going to run some investigations to find out the cause. But as you said that she's pulling the ear, so the most probable cause could be the ear infection, which lead to the fever, high grade fever, and after that she had this episode of convulsion, or in layman term we call it as fits. So
Yeah.
I hope that addresses your concern.
Oh no, that's that makes a lot of sense actually, doctor. Thank you so much.
But to be on the safe side, we are going to run some blood tests as well to find out the condition, and to be in a better place to tell you about the infection or source of infection. And other than that, I'm going to do some ear examination as well, to be confirmed about the source of infection, which in this case might be the ear. And
Yeah.
any concern about the management you want to ask me, or should I tell you about my management plan?
Yeah, what would she, is there anything that you'd like to give her, doctor? Does she need it?
Yeah.
Would she benefit from anything at all?
First of all, I would like to subside their fever. For that, I'll give your daughter a Burfreen or Calpol syrup, so the fever is subsided, and she does not have to have another episode of this fit. We have to be safe that the fever is subsided firstly. Then after that, we should give the antibiotics to fight the infection, and
Yeah.
along with that, we will involve the ENT team as well, so that they can look after your child in a good position. So I hope that clears some of the concerns. Do you have any other question?
Oh no, that makes a lot of sense. Thank you so much. The antibiotics that you mentioned, how long do I have to take those? Does she have to take those for?
So normally we give antibiotics for like 4 to 5 days.
Okay.
And the general idea is 4 to 5 days. But if the ENT doctor sees your daughter, and if she recommends the medication for a longer time, we'll prescribe that accordingly.
Okay, it's just that she doesn't like tablets, my daughter. I mean, is there any alternatives you could give her?
Yeah, sure. We can give syrups, and but if
Okay.
if we're not sure, we can give some IV or Entos to be if we have to quickly subside the infection. So I mean, she had a convulsion, so we have to involve the specialist as well.
Okay, and I've got one more question, doctor. I've been hearing about epilepsy and stuff. Is there a chance that she could have epilepsy?
The good news is that there is very few chances that the child get epilepsy after febrile convulsion. So I mean, there is not enough chances to have epilepsy after febrile convulsion.
Okay, so there's a very small chance, is there?
Very small chance.
Okay. And what about having another fit like this one?
Yeah, there are some chances. I mean, 1 in 6 chance that she might get another episode of febrile convulsion. So for that, we have to be sure that she does not have a high grade fever again, and she sticks with the medication plan, the one we are going to prescribe.
I understand. Thank you so much, doctor.
No problem. Anytime. Thank you so much for coming here.
Cheers. Okay. Excellent. Right. So how do you feel that went?
History, I think I just messed up a bit.
Yeah, your management was much better than your history.
Yeah. History, I was a bit fumbling, and history, I need to improve my history.
Yeah, I think it was you're trying to kind of micromanage kind of what questions to ask and listening at the same time. And I think with practice, when you kind of will have it dialed in more, what questions you need to ask, then you'll have more kind of brain processing power to focus on the actual patient and what they're saying. So I think that's one of the other advantages of practicing regularly, is it does help with that. So yeah, you explored the symptom well. I mean, for a seizure, I think for me, I like to keep things as simple as I can in my mind. So for me, if I'm thinking of a seizure, I think before, during, and after. That's the way I like to structure it. So you asked nicely, is there anything that happened, anything in particular before? How was she feeling before? Was she well or unwell? Fever? So they're good questions to ask before. You could ask then about during the fit, if she witnessed the fit or if somebody else did, about incontinence and uprolling of the eyes and tongue biting, if there's any injuries afterwards as well. Was it kind of the whole body or just part of the body? And then you could talk about afterwards, so the post-ictal confusion, was there any, she herself afterwards? Was she her normal self afterwards? any headache or anything like that. Yeah, so or tiredness. And then I would just ask about associated symptoms then, you know, so anything else. So then that's when the actor or actress would, you know, tell you about the pulling of the ears and maybe the fever and things like that. If they don't ask, mention it, then you can. And you can maybe with pediatrics, it's always useful to do like a top to bottom screen, infection screen.
Yeah.
So, you know, like I like to do like head to toe. So like head would be like meningitis. So I could ask about rash, for example, fever. And then you can ask about neck stiffness if they're older. And then you could move down to like you know, upper respiratory tract infection, so sneezing, coughing, sneezing, and runny nose, that kind of thing. You can ask, then move down to the chest, ask about coughing or breathlessness, you know, for things like acute bronchiolitis or pneumonia. And then you can move down to the abdomen, so you can about gastroenteritis, so you can ask about diarrhea and vomiting. Then you can move down to the genitalia, so you can ask about UTIs, burning, was she crying when she pees, or is there a foul smelling urine, that kind of thing. And then just anything else at all, infection screen. Yeah, the ears as well. Ears important as well. So acute otitis media, so pulling on the ears or crying whilst pulling on the ears, that kind of thing. And then I think important thing is, you know, so I think you mentioned all the main, you kind of identified the main issues, I think, in that case, and you addressed them. So you identified what it was. It's the febrile convulsion. So one of the big issues is that this is not serious. So there's nothing there that tells you that this is something serious. You know, so she had a fever, which is a good sign that it's probably just a febrile convulsion. She's within the age group 6 months to 6 years where febrile convulsions are common and expected. I think below 2 years is kind of a bit of more concerning than after 2 years. So she's at a nice age group where it doesn't really concern you that much. What are the other issues? Yeah, the epilepsy issues. So, you know, when the patient asks you about, you know, they'll be concerned because it is when they witness the convulsion, it's quite, you know, it's quite traumatic to the mother. So you need to reassure them that it's not something that's concerning you. But at the same time, you know, you need to explain that there is a slightly increased risk of developing epilepsy later on in life. But for the most part, if she's getting convulsions alongside a fever before the age of 6, then it's not something that concerns you, provided that it's not, you know, it doesn't last. Oh, that's another important issue is the length of how long the fit was. So if it was like more than 5 minutes, then that would be more concerning, but hers was less than a minute. So again, that's not concerning. So again, that's the major issues is the length again, the presence of fever, is it epilepsy or is there a chance of there being epilepsy? So reassuring the patient, that's another important issue in this particular station. But otherwise, yeah, and you know, giving some paracetamol or some Calpol you mentioned, and something to treat the underlying cause of the infection. So yeah, I thought that was good. Yeah, maybe worth asking about a family history. Oh, you did ask actually, I think. Did you ask about the brother?
Yeah, you told me.
I told you, but you didn't ask. Okay, cool. Yeah, just family history of epilepsy, another one. That might be worth asking, but it's not, you know, it's not something that's gonna pass or fail you.
That's
What's that?
I just hope we get simple scenarios like that in exam as well.
Yeah, it is nice. I mean,
I have heard it's getting a bit complicated. I mean, the old cases are not getting done as well.
Yeah, I mean, we've got lots of time, so we'll start off with these kind of more classic cases, And then once we've refined our kind of technique and everything, and doing it within the time limit that we've got, then we can tackle the kind of more complicated ones, or the less conventional kind of cases. So the important thing when you're explaining something like a febrile convulsion is reassure, explain that this is common, explain the age group, 6 months to 6 years, and that's, you might want to say that it's an unknown cause, that the mechanism isn't entirely understood, but when it happens within that age group, it's not something that's necessarily concerning, and there's only a very small, slightly increased risk of getting epilepsy later on. And the other thing is, the risk of epilepsy is very small. Did you mention inflammatory markers when you're doing blood tests?
I just mentioned about the CBC, not the complete infection markers.
Sorry, it's a bit muffled. What did you say?
I said I just mentioned about the complete blood count. I think I didn't mention about the rest of them.
Yeah, so what I like to do is, I mean, it's open to, whatever your style is, but because of time, I prefer not to list every single routine blood test, like full blood count, UNEs, LFTs, CRP, glucose. I'm not going to list them all, so I would just rather say routine and then including, and then list, state the ones that are relevant here, most relevant here. So in this one, the most relevant one's probably inflammatory markers, your CRP and ESR. I'd say that's enough.
Inflammatory these are the more relevant in this case.
Yeah, and the bedside test, urine dip, maybe you want to do a urine dipstick, and then but the important one is the examination. You got to look inside the ear. That's the main thing.
But do we actually have to?
No. So this is a consultation station. So they will be separate examinations, separate stations for examinations, where you have to perform examinations with mannequins. But with this one, it's just a consultation. So either it will tell you what the examination findings are in the case, or the examiner will tell you, or he'll give you a sheet of paper, slip you a sheet of paper or something with some results. One more thing I just want to add about before we move on to the next station is giving advice about what to do if a fit happens again. So that's important. So because I think the main 3 points really are, number one, remove anything in the surroundings that's nearby that could be dangerous, like so they're not hitting things. Like, so that's the first thing. And just don't put anything in their mouth, and put them in the recovery position. And explain what the recovery position is. So on the side, left or right, doesn't matter. And then the final one is to call the 999 if it lasts for longer than 5 minutes.
5 minutes.
Yeah. I think. Yeah. So I think they're the main things, because that's so she knows what to do next. I think a leaflet is definitely handy to give mothers in that kind of scenario as well. So try and slip that in at the end. Just before you go, I'm just going to give you a leaflet just that'll give you some useful information about what to do if she has another fit, and ways. So that kind of thing.
The main game is finish all this in 8 minutes, the history, the management, and
it's very difficult. Very difficult. You've really got to practice. Really, I mean, that's just emphasizes, because the timing is so
limited. We have to be quick and be conscious and all.
So you have to be in autopilot mode, just in complete autopilot mode, so that you're just completely.
We don't have
all
to
your
think
energy
much.
is focused on tackling this specific case that's in front of you. It's not on thinking what am I going to say next.
Yes. If you have to think, the 8 minutes is going to fly, and we're left with management or any one part of it, so we're definitely going to suffer. So the time management, and also we have to be concise and with good information, and we have to satisfy the patient and all the issues.
Yeah, absolutely. I completely agree. Well, that was great. Thank you so much for volunteering. That was really good. So we'll just go through what the notes say. If there's anything else that we've missed. So Febrile for fits, incident history before, during, after. Anything happened before? What was she doing? Is it the first time? During, was she jerking one limb or all limbs? Loss of consciousness, which you got, yeah. So you asked all these kind of questions, which is good. How long did it last? Very important. Biting the tongue, wet herself, all those kind of things. Confusion, headache, weakness, post-ictal period, and then differential diagnosis. So just kind of an infection screen. She's got fever. She's got a fever and a seizure. So you've got to think, what's the source in pediatrics? What's the source of this febrile convulsion? And finally, if it's not one of these infective causes, then you might need to consider epilepsy once you've ruled out all those things. But if there's an obvious source like there is in here, then you would never consider that this is epilepsy, really, because she's within the age group, and it's a classic. So with febrile seizures, there's two types, right? There's simple and there's complex. So this is a simple febrile convulsion, and so the risk of developing epilepsy is probably, so the standard range to give mothers or family members of a child who has a febrile convulsion would be like 2 to 5%. So if it's like a standard case, like a simple febrile convulsion like this one with a clear source, then you would say 2%. So one in 50. And then if it's more complex, maybe they're a bit younger than 2, maybe they're like 8 months old, and it was not a generalized one. It was kind of a partial seizure, and it had a lot of atypical features, and there wasn't an obvious source, all that kind of things. And then that would be more in line with something that's like a complex seizure, and so that would be more like 5% chance of developing epilepsy later. And I think the risk of getting a second febrile convulsion is 40%. I think you said what was it? You said 1 in 6.
1 in 6. I read it in the course the Plabbable. I just had a rough idea.
Just one in 6 of getting a second febrile convulsion.
Yeah, I'm not sure if it's correct or not, but
yeah, I'll double check that, because I think I've read a bit more. I've read about 40%, which would be much more than 1 in 6. 1 in 6. But yeah,
we have to find out.
So yeah, family history of febrile convulsions, and then the Biden, that's all fine. You asked all those, so you managed to fit all those in, which is really good within the time. That's great. Ideas, concerns, expectations. So really, I mean, so you need to address any ideas about epilepsy, address those, or concerns about it being epilepsy. You need to and address any expectations in terms of management and all that kind of stuff. So this is febrile convulsions due to ear infection. You explained that very nicely. 6 months to 6 years, temperature more than 38, likely to be free of having convulsions after 6. So it's not epilepsy, but it's been linked with an increased risk of having epilepsy.
After 6.
Sorry?
I said it's after 6 years, the increased chance of epilepsy.
Yeah. And then, so I mentioned inflammatory markers, also blood sugar is important as well. Yeah. So amoxicillin for 5 days, if allergic to erythromycin, and something to control the fever. Avoid any kind of excessive cooling. Yeah, excellent. So, oh yeah, during the fits, just these are kind of some advice to give the mother what to do next time it happens. Second opinion. Oh, that's always a nice phrase. If you're not sure about anything, or if it's a case that's kind of outside the realms of what a junior doctor would be expected to manage on their own, then it's always good to slip that one in, and that will cover you in terms of safety and stuff. So that's always helpful. So I also need to take a second opinion from my seniors. If they suggest anything else, I'll let you know.
Yeah.
Yeah, safety netting. So rash.
Rash, yeah. I forgot about that.
Yeah. I mean, but in this case, it was kind of like a clear cause, but yeah, definitely do, if you can, if you've got time, do an infection screen of all the common kind of infections that kids get. And then maybe, advise her to arrange a GP follow-up appointment in a few days.